Hi, everyone. Nice to see everybody's slowly joining on here. 1 o'clock here in Toronto. I see Lorenzo, who I'm going to be interviewing, and Karen and Svet. Nice to see you also joining in. So I'm just going to quick add in Lorenzo here. There we go here. Oh, there we go. Go live with Lorenzo. Lorenzo, I'm still somewhat of an Instagram live version, so I appreciate it. How are you, Lorenzo?
Hi, Roger. How are you today?
Good, good. I have to do a quick wave to my wife, otherwise I'm in the doghouse here. So,
Sure. We can both wait together.
so thank you for agreeing to my these biweekly chats. You're very much still working. Boy, if there's any essential service on the planet right now, it's very much biopharma, with all of the testing and what have you that you're doing. So thank you, for agreeing to let me pick your brain for a while.
Sure.
For those of you tuning in, and we're also saving this for LinkedIn as well, and the transcripts. Renzo DiCarlo is the CEO of BioPharma. Renzo will talk a little bit more about BioPharma. BioPharma is a full-service contract research organization. And I actually just read on your website that you were green-lighted or stamped from the WHO as well on doing global testings and what have you. And I also see Yves is on here and Daniel from London with the Commonwealth Fashion Council. It's nice to see Daniel tuning in as well. This is for the next hour, is going to be turning out to be very much an informative discussion on Renzo and I kind of joke about our hashtag to mask or not to mask, but it's truly a question and a lot of misconceptions and misinformation out there as well. So Renzo, I'm rambling. If you don't mind just taking a couple of minutes and just
Sure.
letting our viewers know who and what is BioPharma Services.
Sure. So we're, as you said, and as most of the audience might know, we've known each other for a while now, but we are a clinical research company and we do first-in-human drug development. So we are working on various products and treatments, including COVID-type treatments as well. And we are WHO certified and approved, as well as FDA, Health Canada, MHRA in the UK, and the European Union. So we do work for almost everyone around the world on drug development.
So you're also at the stage where it's human trials. Where can you define that for people as well? Where some that may or may not know the process before aspirin, becomes on a pharmacy shelf or at the local, food mart.
Sure.
What are human trials?
So throughout the life cycle of drug development, you go from benchtop to in vitro to in vivo trials. In vivo meaning life, in vitro meaning bench glassware. And so halfway between the bench and full-scale population, we do small, very focused population trials between 12 and 70 subjects, maybe sometimes 200, but they're small compared to larger trials where you expose the drug to 10,000 people or 100,000 people.
Right. And I've, for those again listening, I've been to BioPharma, and Renzo's like, Roger, the masks are over there, the white gowns over there, the
Right.
rooms, it's high security. It's quite impressive, and I get it. There's cameras everywhere. There's doctors. There's nurses. It's quite serious. On obviously you're at a stage now where a company is relying on you guys. Does this work? Does this not work? So that's where
we're still looking for white males for clinical trials. So you can always enroll, Roger, whenever you feel like it. I'm joking.
Yeah, I can always use a few $1,000 on the side since I'm at home.
That's right.
And it's an interesting comment. It's great side money for a lot of people. that just want to go in for testing for a day. And it's, you know, it's a beautiful facility where there's flat screen TVs everywhere and there's food. And aside from being hooked up and everybody's watching you, you know, it's a fascinating, you know, side business for people as well.
And I've done my own trial so that everybody's aware that I've actually enrolled in my own trial many years ago when we did a trial that was sponsored by BioPharma. So I can give you a perspective both as the society, as the leader of the company, but as well as a volunteer before on drug development.
Yeah, no, I remember you made a comment where you had no problem either, you know, of stepping up and just showing how safe it is as well.
Yeah.
So obviously, as you know, I'm heavy in the fashion industry. You know, for those as well, Renzo, just to give some clarity, Renzo also sits on my advisory board of Canadian International Fashion Film Festival. Renzo is absolutely brilliant on how he sees the world, how he sees business, how he sees groups together, and he's absolutely been invaluable to me with the Canadian International Fashion Film Festival. And we're going to talk about that later this hour as well, on where we are with group settings. Renzo is also part of, and I'll let him chat a little bit more about that, but as governments want to make a decision on whether it's reopening or even before COVID, you know, what do we do? You know, Renzo is part of that pool of people they go to for advice on what do we do, whether the governments, you know, I can't speak for other countries, but in Canada, you know, they seek out the professionals, you know, that are very much involved. So the discussion today is going to revolve around fashion and, you know, what part does fashion play in this new society of masks and PPE, personal protective equipment, as I'm slowly, you know, getting to understand all of these analogies. So to mask or not to mask, you know, what is your take on this? You know, aside from being a tinkerer in my garage and standing, you know, and I've got my masks, you know, I've got a few here for the purpose of discussion.
Sure.
Why should I wear a mask?
So in the current environment of COVID-19, more than likely all of us will have to wear a mask at some point in time this year. And the mask really, unless you're infected, is really for me to protect you.
Right.
So if I wear a mask, I'm really creating a barrier between my face and you, so that in case I'm asymptomatic, or if I don't know if I have the disease, I'm making sure that I minimize the risk to you. I am not wearing the mask to protect myself. The only time you wear a mask to protect yourself is when you're dealing with a confirmed COVID-19 patient.
Okay.
That's where you have to be hands-on, like some of our doctors, and you want to keep yourself safe. Then you would use a plastic shield, an N95, which is what you were waving around, or a surgical mask, or whatever. But most of the time, you're wearing a mask out in society to protect other people and reduce the amount of transmission of the virus, because the virus is highly transmittable.
So Martine had made a comment below there that does the mask completely remove the risk to others? But let's say I'm healthy. Let's give two scenarios, and then we're gonna dive into obviously the fabric masks. But fabric versus N95.
Right.
And for those, just to give some context, N95 stands for, if I'm not mistaken, I'm just trying to find my notes on this, not involving oil, or you can clarify that. 95% being it backs out 95% of organisms, what have you. Can you define what an N95 mask is?
So it's basically, the important part of the mask is the efficiency factor. It's 95% efficient. So
Okay.
it's filtering out 95% of particulate sizes. Okay. Surgical masks are probably between 60 and 70%. Cloth masks are 40 to 50%. Scarves will give you a certain amount of protection as well, right?
Okay.
So you are minimizing the rate of transmission. So based on Martine's comment, is there a benefit? Yes, there's a benefit in the sense that if I'm healthy, you don't know if you're healthy unless you do a COVID test on you. And it's not enough COVID testing around to confirm that everybody is either asymptomatic or doesn't have the disease, or they do have the disease. Okay. So everyone should assume that they're at risk, but you only need to use the mask if you're within 2 meters of a stranger.
Okay.
If you stay 2 meters away from someone, you're fine. It's when you get within that radius that you need a barrier to help minimize that transmission.
So let's say I do have COVID-19 and I'm out and about, I need my grocery shopping, I'm a bit of a rebel, but if I'm still 2 meters away from someone, they are perfectly safe. Is that what you're saying?
Right. So if you follow proper hygiene and you stay, let's say you're COVID-19 positive and you don't know it, you follow proper hygiene, you don't, you Purell your hands, you wash your hands, you're not coughing in your hand, you're wiping the table, then the odds of you giving it to someone else is low, right? But if you practice proper hygiene. Why are airports a high area of transmission? Not because of the plane per se, it's the volume of people who go through there.
Right, okay.
So you didn't wash your hands, you put it on a railing, someone touches it, they touch their face, they touch their nose.
Yeah.
But the other purpose of a mask is you're creating a barrier so that my hand doesn't touch my face. Okay. So yes, to a certain extent, it's also protecting you because it's harder to touch your nose and face when there's a mask in the way, or a scarf, or a cloth mask.
So I've got one here, and Martine, if you're listening, my Gregory Allen Fresh Rejects mask is apparently at the door. So Dior and I mean, I could go on and on and on Prada, Chanel, Louis Vuitton have all got into making fabric masks, which I'm actually quite excited to hear your take on this, because a lot of our designers here in Canada have redone their production lines. You have said as well that a simple fabric mask or a scarf could work as well. You know, this is one that I've got, just a simple bandana, which I'm actually going to put on for the purpose of the discussion. So Renzo, let's say I'm perfectly healthy. And
where's the Harley, Roger?
I'm sorry?
Where's the Harley?
Where's the
Harley?
It's like it blocked off my hearing too. Yeah, it's definitely, whether it's fashionable or not, and thankfully you can still hear me, I can still breathe. Let's say I'm perfectly healthy. You made a comment that even though it's not an N95 or it's not a surgical mask, I am protecting more others than I am protecting myself. Can you clarify that?
Well, you're protecting others because you have a barrier between your nose and your mouth. So if you're, right. The virus transmits in particulates or water vapor. So you're now creating a barrier between your mouth and mine. If we come within that 2 meters, and I mean within, not outside of the 2 meters. The other thing that you're doing by wearing a mask is you're preventing yourself from touching your face.
Okay.
You can't touch your face and your nose and your mouth if there's a mask in the way.
Aside from eyes, because you said, you know, that the nose, or sorry, the ears are not a point of entry for the virus?
Yeah, so you're looking at your respiratory system. Your eyes are connected to your sinuses, things like that. So you want to avoid touching your eyes, touching your nose. Less concerned with the ear, right? Okay. And so that's why people will also wear goggles or glasses whenever they're in a surgical area or a medical area, so that they're not touching their eyes, right?
Okay. So that's why the full face mask. I mean, my local
So the face shields are for someone who's highly contagious. You're in an area that you're at high risk. You know, your face shield is 100% efficient. It's not like a virus is going to go through glass or plexiglass.
Okay. So it is highly efficient.
So highly efficient, but people don't walk around with a jar on their head, right?
Yeah, well said. But you also mentioned, I mean, the face mask, sorry, this one here, you know, it's not stopping me from touching well, it is actually, you know, it's not touching, you know, my nose or my mouth or eye, so to speak. But why is there so much paranoia on touching surfaces and then touching our face?
Because it appears that the virus doesn't need a lot of units. So viral load is always measured in units of virus.
Okay.
So if you have LabCorp or Dynacare or Life Labs or Quest that does a diagnostics test, okay, it's actually measuring the viral load in that test. And a virus, if you have one viral unit that contaminates you, doesn't mean you're going to get the disease. You might need 1,000. You might need 1,000,000. This one appears to not need a huge viral load to get you infected. So if I touch a railing and I put 100,000 viral units on that railing, and I tend to absorb 1,000, for example, then it's a transmission issue, right? There's more and more viruses around for that.
So Martine's got a comment there. Does a fair amount of particles remain in the air and therefore increase the risk of transmission while indoors?
So a particle, again, the reason for the 2-meter limit is the virus is usually in a water particulate. And that will eventually, it has a weight, gravity will take over, it will drop within 2 meters. That is the reason why the 2 meters exists.
So somebody in front of me, I'm walking on a sidewalk, somebody is 2 meters in front of me, has the virus, they cough, it's in the air, and I'm walking into that air. That is a potential, correct?
If you're within 2 meters, yes.
So let's say I am away from 2 meters, but as we're walking at the same speed, to Martine's point, you know, that particle is in the air before it settles. It may have settled on me.
Well, again, I mean, the 2 meters is a guideline. It's sort of like a train, right? 2 trains approach each other. If you're 2 meters apart, but then you get into 1 meter, yeah, you might be exposed. If you start at 2 meters, if you're 2 meters behind someone else and it's dropping, but you stay 2 meters away all the time, you're fine, right?
Yeah. So as we're going to talk about fabric,
but again, it's all about viral load. Just because you get 100 units in your body doesn't mean you're going to get infected, right? It depends on the amount of virus.
Right. So the fabric mask, I saw something online, and you and I have had this discussion where, again, so many designers and they're putting their own great spin on it. You know, same with Gregory Allen with Fresh Rejects, which has got great prints, and some are doing houndstooth prints, and they're kind of all over. But one of the things as a consumer, I was reading, and you and I discussed, where they say it's a light test, where you hold the fabric up to a light, and if you can see light coming through it, it's not dense enough. It should be able to block the light. You had made a comment about cotton. You know, we discussed polyesters as well. You know, there's got to be as well, I'd like to say, if this is going to be, you know, in vogue now, wearing face masks for the foreseeable future, comfort is a big part, you know, for all of us. What is your take on fabric masks? As consumers, you know, the vast majority of us that are healthy, what is your recommendation as a health professional on what should we be wearing?
You put it back on, that mask isn't useful anymore.
Interesting. Daniel in London from the Commonwealth Fashion Council just asked a question. What materials offer the best filtration? Organic, cottons, polyester?
The nice thing about cotton is it's proven in certain environments to be less likely to breed other pathogens. So you may not get COVID, but you might start getting mold and other things associated with it. So cotton seems to be better than polyester. But again, there are a number of literature searches on different materials, but cotton seems to be the most breathable, the one that you can wash the best, that maintains cleanliness. Again, if you have a cotton mask, you should wash it every day. You probably want 3 or 4 different masks that you can, you know, mix and match.
Right. Yeah.
I have seen people out in public that have made their own masks, and it's a fashion statement. And to be honest, if it promotes that safety, you know, you create a fashion trend that at the same time you also promote good safety practices.
Well, yeah, I mean, even on that one, you know, the one thing I'm proud of the fashion industry for really stepping up during this time, you know, aside from it being, you know, opportunist, or call it what you want, it's also an opportunity, you know, to grow in accessories, and accessories are always the best margin, you know, in any industry, and very much so in fashion. And let's be honest, it's not a lot of fabric, it's not a lot of sewing capacity either to produce them. I read a report a while ago on mask culture, and they suggest you actually have, similar to your underwear or your undershirts, you have a 7-day supply. So to your point, Renzo, when you're doing your laundry on Sunday afternoon, all the masks go in, and you've got then a fresh supply for the week ahead. And I think that's one of the advantages of, you know, the fashion industry getting involved, where it may not necessarily be about the fabric per se, whether it's cotton, polyester, or an organic. It's the fact that it is actually protecting others as well, and being, you know, a good social citizen, on aside from good hygiene, not touching your face, practicing, you know, good social distancing. Where the fabric masks are, when they first came out and they were all over the market, I kind of thought maybe our industry was just being a bit opportunistic, but it actually is turning out that it's in demand, where governments have literally posted, you know, do-it-yourself masks online. You know, I've heard everything from people using coffee filters, whatever have you. One of the things I've seen out there, and I don't know if it's just a waste of time or energy, are these fabric masks that actually have a filter insert into them. What is your take on those?
So again, it's like the scarf. You know, the more you layer, the more efficient it is. So if you have an insert in it, you're adding to the efficiency of the filter. So yes, it's better, but then how comfortable are you wearing it? Are you okay with it? And everyone's preferences are different.
Okay.
And it also depends where you're working, right?
Right.
If you're staying 2 meters away, you may want something that's more breathable than something that is more restrictive, right? I can guarantee that wearing this mask all day long is not easy.
Yeah. Well, let's just talk about that. So you're going to give me a bit of I've got a virgin mask. It hasn't been bent whatsoever. I probably already contaminated it by touching the inside. But you had done a practice for me where you actually fitted it to your nose, and then without putting the straps on, you were able to breathe in to see if you've got a proper fit. Can you?
So you first seal the top of it.
Okay.
And then see if you can hold it without the straps. Right? That's how you know you have a good fit. And then you obviously strap it to your head at some point in time when you want to wear it properly, but you want to create a good fit. There's no point in having a 95% mask if the sides of it are open. Right? Then you might as well just wear the surgical mask that's more comfortable.
Right.
Every day, which is more 60 to 70% efficient and just as good.
Well, I'll be honest, the fabric, you know, is a lot more stylish and a lot more comfortable. So stylish aside, you know, I want to be safe and I want to protect those around me. You know, surgical N95 is 95% protection. Is there a number on a fabric mask? There's got to be some, it's not zero.
It depends on the material and how many layers, and then you have to test it. There is no specific number because every design will be different, right? We know that it's probably around 30 to 40%. However, if you layer it, if you have different features to it, if you have an insert like you talk about, I mean, you see some of these fancy masks that'll have like a carbon filter on it. You see the little dial on it. You can put a cartridge in. So it really depends how it's designed.
Okay. I see Monica is on, joined the conversation as well. Monica is a model. She's in Montreal. She's also works in the medical industry as well. So it's very much involved with this market. I do want to talk about post-COVID. So as we start meeting and gatherings, and you and I are involved with the Fashion Film Festival, where we're anywhere from 300 to 500 people. There's professional sports. We're also in a society, very much in a fashion industry. We hug, we cheek kiss. What's your take on the new normal?
Unless you want to spread the disease, you need to keep your distance.
For how long?
Probably till 2021.
Wow. They do feel, is that the advice that you're giving the governments or others that are looking to see?
Well, I think some governments are gonna, when they talk about lifting social restrictions, it's going to be gradual, and there'll be a lifting and then a compression and a lifting. There's going to be more than one wave to this. Unless you're on an island and you can completely isolate, it's going to be difficult. And when I talk about lifting, maybe restaurants, instead of having 100 tables, only have 25, and they're spread out.
Right.
Maybe the people who that are serving are wearing masks when they serve you, and you stay, separate from others.
Right.
As you know, airlines are willing to operate, but they're going to operate with masks.
Right.
Not to say that you're 100%. Yeah. So I think our normal is different, not as restrictive as it is now, but unless you want to see a huge uptake, like this virus probably has what's known in the industry as a 2.6 R0 value, and R0 means the ability to spread. If the flu is 1.8, this is probably around 2.6.
Okay, wow.
And even though that's not a big gap, if you multiply 2.6 people infected by 2.6 by 2.6 by 2.6, that one original person who created communal spread can get to 1 million in a month by just doing 2.6 by the power of 10 or whatever.
Wow. So that's why we're seeing the numbers globally at 3 million, or quite frankly, those are the numbers that are reported. So we don't know, how much worse that really is. Do you take, obviously you've been in mask culture for many, many years due to the nature of your work. We talk in fashion where 1983 was the movie Flashdance, and overnight it was leg warmers and off the shoulder sweaters. There was Tom Cruise and Top Gun, with the Ray-Bans. And, due to this, global crisis right now, it's face masks, are the new fashion it item. What's your take on, is this going to go away fast? You mentioned 2021. Do you think this is going to be something that is here to stay? Obviously, it will die down. To your point, will be coming back again. At what point do you see it just being part of the normal?
Until there's a vaccine, which, depending on who you listen to, is probably between 9 months and 18 months. And even if there is a vaccine, you still have to give repetitive vaccines, just like the flu.
Yeah.
Because it's an RNA virus and it knows how to replicate quickly.
Yeah. Just
like the cold or the flu.
Right. And
the other thing is that we have to protect our vulnerable people, right? So people who might be in long-term care facilities or vulnerable people, we have to protect those people. So I don't see masks going away anytime soon. It could be in the next 2-3 years, but also we may start seeing in North America and Europe what we already see in Asia. So for example, many people will know that due to SARS or H1N1, many people in Asia, if you go to Asia, you'll see occasionally people will wear a mask. And so what you'll probably end up seeing is, even if the general population isn't using as much, you may see 5 to 10% of the population when they go out in public still comfortable wearing a mask.
Right.
So it's not going away.
Okay. I have a background, obviously, in the promotional industry, and Joe Gugliani and others, friends of mine that are tuning in or will be watching this afterwards. You know, the promotional industry very much, you know, it's a massive industry. It's your pens, it's your notebooks, you know, portraying your company's brand, your message, what have you. The promotional industry has gotten involved now in branding of masks. It's a difficult
I think
question.
Corona Beer's got one, doesn't it?
I'm sorry?
I think Corona Beer's got one, doesn't it?
Oh, okay. That it's an interesting one, but that one I haven't heard. But you know, if anyone's going to have one, it's definitely going to be them. But I think my question to you is: when is too soon? When is distasteful or opportunist? And I don't have that answer. You know, and for you as a health professional, a CEO of BioPharma, which sees the world in a whole different way, you know, than we do. You know, is it a good thing that the promotional companies are jumping on it? You know, as Joe's comment, you know, it's a target client, there's no question, and it's being a good global citizen as well. But what is your take on all of a sudden branded face masks out in the market?
I actually don't see anything wrong with it, because if it promotes people wearing it and it becomes a fashion statement, then you get two birds with one stone. People feel comfortable, they feel safe, and they don't feel awkward. And isn't that what the fashion industry is about? Making people feel comfortable.
It's personal
it's an accessory like anything else.
Yeah. Yeah.
And it needs to also be, you also need to be aware that a lot of people are stepping up right now, not for money or promotional reasons, but a basic need.
Right.
So a lot of the masks being produced around the world now are either people that are recycling old cloth material or creating new need, just like ventilators, to meet a huge need.
Right.
I think you sent me an article the other day saying that the general public doesn't need to wear masks. I forget which article that was.
It was from the WHO.
So WHO.
Yeah.
So when WHO says that, it's not that they don't want you wearing a mask. They just don't want you taking these masks away from medical workers. So you'll see that WHO will change its tune when there's enough masks. It's going to say wear a mask. But right now, it doesn't want you taking these critical masks away from first responders. Because if they don't have it and they're dealing with COVID patients, we're doing a disservice to the people that actually need these masks.
But let's say there was a global glut in the marketplace of surgical masks and N95 masks. You know, to your comment, you know, where the fashion industry is stepping up, you know, across all brands and making, you know, simple, you know, fabric masks for the consumers, which the large percentage of society doesn't need an N95 or a surgical mask. They're more about protecting others as well, and safe distancing and good hygiene. Where do you find, you know, that blend going forward? Because obviously 3M and others are stepping up the production on medical and surgical, and at one point, very quick, you know, there's going to be a glut on the market. But going forward, you know, what would you wear? You know, if you're out on the street, what would you be most comfortable wearing yourself?
If I had to violate the 2-meter restriction, then I would wear a cloth mask, because it's just like a scarf. I can wash it, I can recycle it. You know, you don't want to use up the surgical masks. Yeah. There's a reason why surgical masks are sterile, but you don't need them to be sterile.
Okay, interesting.
Right? You need them to filter and to cover your mask, but you don't need them to be sterile. Right. Sterile is for the surgical room.
Right. So I'm gonna throw you for a loop on this question. You know, you've seen everything in and out of that facility. due to the fact that you're audited so much by global pharmacies. And I think when I had visited you once, you had an Indian pharmaceutical company and another group, like you're nonstop being audited. So you're seeing things in the industry being used that others may not know about. If you were to share a piece of advice or maybe an opportunity, for the fashion industry, what could we make that nobody knows about, aside from gowns and aside from the masks? What other kind of a fabric, fashion accessory could be made to help protect global spreads of viruses?
You mean other than masks?
Other than masks.
It's a good question.
The next big curve, so to speak.
That's a hard question. What you could make is fancy glasses that you don't touch your face, right?
Could that be an entire face covering, where you literally then, those that my local Metro, store, literally, the staff are full face masks as well. So they're already out there. I can imagine they're not that comfortable, especially if you're wearing glasses where they're fogging up. But with any type of creativity or global pandemic, creativity is just through the roof. We're seeing it.
But again, I mean, you got to put things in context, right? A face shield is used for people that are dealing with COVID patients, not because you're going to the grocery store. You're not going to get within 6 inches of someone, right? Especially their face.
So it's overkill, what you're saying.
Yeah, I mean, I would focus on the mask, the fabric, the glasses, anything that prevents you from touching your face, maybe gloves, right? Because these gloves obviously are nice colors, but they're plastic, latex, right? But even gloves that are easy to slip on, slip off, that are easily cleaned, you can take them off and on. There's a role for that too. Again, anything that keeps you clean and keep yourself safe.
Okay.
But again, everything is as good as how you use it. If you touch every surface of this, you defeated the purpose. Same thing with the gloves. There's no point wearing gloves and then touching your face. Right. You don't touch your face.
Right. So you made a comment, if we're practicing good social distancing, I'm wearing a face mask, others might be N95, whatever have you, then all of a sudden, the world is slowly opening up. I can break that barrier between, myself and you. At one point, will the fabric masks just be part of our overall wardrobe, where I can't practice social distancing? I'm on Bay Street during rush hour, and I've got somebody a foot away from me. I mean, we cannot be practicing social distancing forever. What's your take on what's the next stage of this?
Well, again, in 2020 there'll still be social distancing. I think 2021 there might be less of it.
Right.
You're going to use more of the mask to allow yourself to get in closer with people. You may not have the large concerts of 50,000 people for a while until you have vaccines.
Right.
So, yeah.
You take professional sports, obviously, you and I are involved in fashion film, where we're only 500 people. What happens when, the Cineplex theaters open again, and you're 200-300, you have, major sports stadiums where it's 20-30,000, opening up and literally beside each other, and people are yelling and screaming, and I'm sure it's a petri dish as well. What's your take on what's the new normal, within that market as well?
So in any sports venue, more than likely they'll play without an audience or a limited audience. Maybe some of these stadiums will allow people to be in their box seats.
Right.
But you're not going to allow 50,000 people to watch a game. The game will probably be televised virtually to people versus being in the stands.
Right.
In terms of in terms of certain areas like film, cinema, operas, theater. Maybe they end up taking out every second seat so that you got more social distancing in the theater. The same thing goes with gyms. You might reserve every second machine so that you can maintain social distance in the gym.
Right.
But if you have large crowds that are within proximity, like an airline, that's going to be difficult.
Yeah. And you feel it's and just to tap onto Joe's comment, you feel this is actually going to tie right into 2021. I mean, we're now, what, 4 months finished in 2020. You actually feel this could start to go into 2021 as the second wave of COVID comes through?
Well, there'll be 2 or 3 waves this year. Let's not be naive. We're also seeing them in other countries already. Again, unless we totally isolate and we maintain distancing, unless you see situations like New Zealand where there's no new cases and New Zealand's able to stay as an island,
right?
You're going to have a scenario where until there's a vaccine or you have 70% of the population that's been exposed, you have to maintain that level of protection.
Right. Yeah. Because you brought up a comment a while ago, and aside from the fashion industry, being heavy travelers and a certain clientele of the world that takes their vacations on a plane, travels around the world, and I brought up, and I'll be the guinea pig here. I brought up the dumb comment to you, going, but Renzo, airplanes are a petri dish of air circulation, and you said the exact opposite. Could you just touch base on that? So where I was going with that is you talk about New Zealand being an island and others, so they very much contain. But the second somebody's coming in from outside of their environment, they could be bringing it in. But to your point, you feel airlines are one of the safer places to be.
Right. So the 2 questions you asked me. So first of all, an airline, the air is pressurized in a cabin and it's HEPA filtered. HEPA meaning high efficiency particulate filters. So you're not really getting it from the air, but you are getting it from the countertops, the railings, the bathrooms, people around you. So if you're able to practice good hygiene and wear masks, you can keep yourself relatively safe. But you should make the assumption that every surface on the airplane could be potentially contaminated. In terms of New Zealand could have a really good record and no more community spread, but as soon as it opens up its airports to foreign visitors, you only need 1 or 2 people to do community spread, and all of a sudden you have the disease repropagating. Because it doesn't take that much, right? If you look at Canada or the US, there's only a couple of thousand cases a couple of months ago. Now you got 1 million cases in the US and you have 40,000 cases in Canada. And that's only within a span of 6 weeks. Wow. We're not talking months here. So you see the replication. I think Martine asked us if we can wear masks in a movie theater and sports events. And you can, but it's a trade-off between how many people, mask versus distance. 50,000 is a little bit big. Maybe a theater of 500 people, you can wear masks. Maybe you can, remove every second seat. What is the threshold of safety that we're willing to maintain?
Right.
And nobody knows, but the more we start thinking about it now, the better we can implement it.
Yeah.
Maybe restaurants in the summer season in Canada be more likely to serve you outside on a patio than inside, right?
Yeah. Well, and it sounds like we might get into a bit of policing on what people are touching. And you go to the grocery store and the staff they're sanitizing everything and they're wiping everything down. And you also brought up a comment to me a while ago that, whether it's practical or not, as we're coming home from the grocery store, technically we should be wiping down the products that we picked, because we have no clue who touched it before we headed to the checkout counter with that. Just a quick question for you, and I'm going to wear this mask, this one here, just for the sake of it, and hopefully you can hear me okay. So, when you were talking about touching the face and, your eyes, your nose, and your mouth being, points of really where you could get the virus, you still have, the spots within your eyes here that are open, which are, and I know you can't have a fully perfect seal, the way you do, with the metal trim here and the straps, whatever have you. Renzo, if you were to redesign a face mask, what would you do differently? Are they okay the way they are? But in your experience, if it is going to become not only a fashion statement, but the new normal, how would you redesign a cloth face mask?
So that is a good question, because I've actually seen some out in public. And they're actually homemade by a number of people. And they'll usually, the ones that I've seen that look pretty good are the ones that have an elastic strap at the top to create a little bit of a seal.
Okay.
Similar to the joint that occurs on these N95s.
Okay.
Right? And so having some sort of elastic band to keep it tight on your face. But again, the concept is you're trying to keep your water particles out of your, to yourself versus spewing them out into the air. Okay. Or as Justin Trudeau said, moist breathing, right? So, at the end of the day, you want to have straps that are comfortable. You can tie it. Obviously, the scarf you're wearing is not comfortable and won't stay on without you manipulating it many, many times.
Right, right.
So you want something that you don't have to manipulate a lot, that is easy to put on and easy to take off.
Right.
Especially for somebody who works in the delivery industry. They're going from house to house. They're getting in and out of their truck, their van. They're going to the door, ringing the door. They don't want to put on and take off their mask every time they get out of the delivery truck to drop a parcel off at your door.
Yeah. Well, and that was a comment I made to you. I'm like, Renzo, why are these people driving around in their vehicle all by themselves, still wearing this mask? Like, it looks ludicrous to me. And again, you had educated me on, Roger, the second they're taking it on, taking it off, they're recontaminating it. It's useless, the mask. So it was a bit of an eye-opener for me on that one as well.
Yeah, and I think, a lot of people judge because that's what we do as human beings. But you don't always know. If you see two people in a car wearing masks, you might say, why are they wearing masks in a car together? But you don't know. Maybe they're strangers. Someone's giving someone else a lift and they can't stay 2 meters, so they're both wearing a mask. Maybe they have to pick somebody up. There's so many variables you're not aware of. I think the important thing is educating people on what's the mask there for, right? If you're wearing a mask, and I've seen this before, and there's, stains on the front of it, I know you've been touching it, right? Then it's kind of becoming useless. That type of thing, right?
Yeah, yeah, interesting. But as far as face masks and gloves, you feel, as far as the contribution to the fashion industry, to this global pandemic, and, I'm quite proud, here in Toronto and in Canada, so many designers have instantly, switched their production lines, to be making the masks. It sounds like really those are the two main critical areas that can really assist in this global issue, and the fact that, all of a sudden fashion is becoming an essential business if in fact you're making, the masks or the gowns or whatever have you. Yeah, aside from our, accessories, whether we love our handbags, and I see Claudia, the regional director of the FGI, has just joined on, it being that new fashion accessory, and I've seen just so many out there, and again, I'm talking in circles, but on how proud I am of the fashion community, and when you brought it up as well on, let's discuss masks as well. Is there anything else, or, in the 8 minutes that we've got left, as a CEO of BioPharma, and, going through, and seeing so many major aspects, what more could we be doing as a fashion community to help, to contribute, to change up our production lines?
I think you should do what you're really good at, which is make masks attractive to people to wear, right? If they feel that it's comfortable, if they feel that it's trendy, they'll wear it. And right now, wearing masks is like keeping social distance. So the more you can promote it, I mean, you look at our metro system right now, and almost no one's on the metro.
Right.
Most of these drivers are driving the metro by themselves. But maybe if people felt that they had a mask to make them feel comfortable, it was natural, it was fashionable, you'd probably see more people in the metro going to work versus taking the car. So making it something that people desire and adoptable and making them feel good, I think, is because technically masks aren't hard to make.
Mm-hmm.
You make them, but making them somewhat trendy, edgy, whatever you need to do is a good thing.
Yeah. No, it's a good comment that you just made on that, because let's be honest, 2 months ago there was a social stigma attached to anybody wearing a mask in public.
Right. That's because 2 months ago people thought if you're wearing a mask you must be sick. Right? It's actually the opposite. You're wearing a mask to reduce the chances of spreading the virus because you don't know if you're sick or not. It's not if you're not healthy, if you're sick, you should be isolating at home, not wearing a mask in public. Should not be leaving the house for 2 weeks. If you're sick, you isolate for 2 weeks. And don't worry about whether you have COVID or the flu or the cold. Stay at home for 2 weeks.
Yeah. You brought up we were chatting a while ago, and this whole the background of the word quarantine. Can you just take a couple minutes, and where did this word quarantine ever come from?
So my daughter actually taught me this one. So quarantine comes from the Latin word or Italian word quaranta, which actually means 40. And it came during the Black Plague when Venice was one of the few countries in the 1400s that survived the Black Plague and did well. And they followed the concept of social distancing. What they said was, we know this virus exists. We know it's impacting all the countries. We're going to force every ship before it disembarks to wait outside in the harbor for 40 days. 40 quarantine. Right?
Where did the 40 come from?
40 is from Lent, right? Christians, 40 days.
Of a sacrifice.
Right. 40 days of sacrifice. Thank goodness they picked the right number, which is more than 2 weeks.
Interesting. And then that's really, it's stuck with us ever since then.
Yes. And the Spanish flu, for example, in 1918, if you pick up old news articles, you'll see the mayors of many cities in North America saying pools are closed, theater is closed, stay at home. They're limiting public gatherings to 10 people, social distancing. So after 100 years, we haven't learned much, unfortunately.
Yeah.
Except for masks.
Yeah.
That I didn't see in 1918.
Well, and you brought up a great comment where, and that was an education for me as well, where, again, the stigma on wearing a mask was somebody's sick, they shouldn't be in public, and, and you're looking at them the opposite, where it's been a full 180 where you see somebody now wearing a mask and they're actually being a good global citizen on just being protective.
Correct.
And is that the messaging that, whether it's the fashion industry, or I don't want to highlight just specifically the fashion industry, but the industry as a whole, on just practicing good stewardship and wearing a mask when you're out in public? And obviously the fashion industry, whether it's Dior or Hermes or just so many others, Chanel, that are coming out with some actually quite, beautiful designs, fresh rejects. I know I talk a lot about Gregory Allen, but they've just done some really cool things. He's got these very Toronto iconic, the raccoon and some skunks, and they're just kind of, they're being fun, and the same with Joe Gugliani, with the promotional industry, where they're getting now brands involved, whether it's messaging. It sounds like it's here to stay, and it's, to your comment, the stigma has gone. What more could we do to really break that stigma so there's more and more and more that are wearing it? And my timer's come up. Wow, time is flying. We have literally 2 minutes left, Renzo. So
what can we do more? Now the pressure's on. What can we do more?
I'll give you the open comment.
I think it's tying it to brands. I think it's tying it to comfort, as we talked about before. I think it's also tying it to social responsibility. And, whether it be protecting the vulnerable, you're doing it for something good, or you're trying to minimize landfill waste and recyclables, because, these things are ending up, believe it or not, these millions of masks are ending up as garbage, right?
Right.
So how can you promote good stewardship within the community?
And the fabric masks, without question, have a longer lifespan for sure.
Right.
Right. Thank you, Renzo. Very, very much.
Thank you too, Roger. It was good. Not orchestrated at all.
I'm sorry?
I said it's not orchestrated at all, and we'll have a manuscript put together of some of the Q&As, right?
Yeah, 100%. We're going to save this video. I've got 30 seconds left. We're going to save this video. We're going to post it, and we're going to be putting it both on your and my LinkedIn. So again, Renzo, thank you so much for your insight, sharing, your knowledge, and I know your time is so incredibly valuable. So thank you.
You too, Roger. Same to you. All right. Thank you, sir.
So thank you, everyone, for joining in. On Thursday, we're going to be having a chat with Lauren Sheriffs from Too Social on social media during the age of COVID, on what companies are doing. And again, thank you so much to Renzo DiCarlo for sharing his time with us. Thank you, everyone. We'll chat soon.